Hi everyone. I wanted to do a quick video on how to treat osteoarthritis, which is just normal joint pain that we all get with using our joints from an injury, and sometimes that causes wear and tear on the joints, and with aging in general. Typically with this type of arthritis, what we usually see is patients are getting knee pain, hip pain, foot pain, and conference after conference that I've gone to, the only proven thing that really helps with joint pain is to be at your ideal body weight, which means having the appropriate weight for your height. So either that could be through your healthy diet, eating well, or through exercise. Ideally, it would be through both. The type of exercise that many people ask me what's good to do is low impact exercise. Water exercise is the best. If you have access to a pool at the Y, at the gym, just water exercise, you're non-weight bearing. It doesn't put pressure on the joints, and it's really good for building the muscles around the joints that are having that pain. So that's the best thing that you can really do. If you don't have access to a pool, another great thing that you can do is walking. Some people feel that they can't walk due to the pain, but what I suggest is starting slow, building it up. Even walking 5 minutes a day and slowly increasing that to 10 minutes a day. And the goal is 30 minutes a day of brisk walking. You can break that up however you want. You can do 10 minutes 3 times a day, or do all 30 minutes at once you get to your goal. But I would say to start slow and slowly build that up. That aside, if you're able to do that, that's fantastic. Other things to help with your pain. One, of course, consult with your doc and see what they recommend. But some things that I recommend to my patients are the most safe medication out there is Tylenol. So I do recommend this. So the Tylenol, typically, I recommend you can take up to 3,000 a day. These happen to be 500 milligram tablets. So you can take 2 tablets as needed every 8 hours. So morning, 8 hours later, noon, and then at nighttime, you can do that again. Again, you don't have to do that, but if you're having pain, that would be the safest thing to do, is to take Tylenol as needed. So I would start, it doesn't matter how many milligrams you start with. They range between 325s to 625s. I happen to have 500 milligram tablets, but you can take up to 3,000 a day and no more than 1,000 at each time. So that's a great safe drug for pain relief. Another great one is anti-inflammatories. I happen to have Advil right now. These are 200 milligram tablets. But as you can see on it, it actually says non-steroidal anti-inflammatory drugs. So any ibuprofen type drug is fine. Motrin, Advil. There's literally 100 different types out there. Most important thing is not to take 2 of the same class at once. You don't want to take Advil with Motrin. But prescription strength would be 800 milligrams 3 times a day as needed. Again, these are all as needed drugs. If you don't have pain, you don't take it, and take the least amount that is effective. If you feel relief with 200 milligrams, just take 200 milligrams. Some patients and people just like natural. If you do like natural, again, exercise is the way to go, and aiming to be at your ideal body weight through diet. But other things that some patients try is the glucosamine chondroitin. This one happens to have turmeric in it as well, and this can be good natural supplement for patients and people who have pain who are interested in more of a natural approach first. If it doesn't work after trying it out for 2 to 3 weeks, I would stop using it. You don't need to use it. With the ibuprofen I didn't mention, you should consult with a doc. You don't want to take it if you have kidney disease, if you have stomach ulcers, if you're on blood thinners. Those are all contraindications to using this, and you should use instead Tylenol. So that's kind of a brief overview. If you have any questions, message me below. Hope that was helpful.